Okay, so chances are at some point you've seen a video here online claiming to help you improve your vision naturally, to do eye exercises or something to reverse your need for glasses or to keep your eyes healthy and see better. And 99% of the time, if you ask an eye doctor in the eye clinic about these, they're going to tell you that they are complete bullshit. However, there have been some new publications and programs that have come out that not only have been winning awards at eye health conventions for their scientific results, but there's even a program that's been FDA cleared for improving vision. So today I'm going to share 3 science-backed eye exercise or vision training programs to improve vision. Hi, I'm Dr. Joseph Allen. I'm a board-certified doctor of optometry, and I made this video because I have tons of people, not only here online, ask about this, but I have patients who come into the eye clinic and ask me this same question. So here are legit ways you can improve your vision. So first, the program that I find has the most scientific backing and validity for improving somebody's visual acuity. That means reading further down the vision chart here at the eye clinic, whether you're wearing glasses, contacts, or nothing, is through a program called Revital Vision. Revital Vision is an at-home computer-based vision training program. I wouldn't say they're eye exercises per se, but they have been shown that with this program in various publications and posters that they can improve vision in children and adults for numerous of different eye health and visual conditions, including conditions such as keratoconus, post-LASIK or post-cataract surgery, as well as for people who are low myopes or maybe have presbyopia or have nystagmus where their eyes are shaking, or even amblyopia or lazy eye. In fact, it has been FDA cleared as a treatment for amblyopia in kids ages 9 and above, including adults. So if somebody has one eye that's way weaker than the other and has that diagnosis of amblyopia, this might be a way to improve somebody's potential eyesight. This program utilizes something called Gabor patches, which is something I learned about in optometry school in my vision science courses, but since then I have never heard anybody talk about these sort of things until I found this program. So Gabor patches look like this. These are basically round spots that have black and white lines in them that either some of them run up and down, some run side to side, others at angles. And it turns out that the cortical parts of your brain that help you interpret vision and see the world around us are very sensitive, some to up and down, again, some to side, and others at angles. And showing these different patches at different contrast levels just so that you can barely detect them, it's challenging for the brain, but also stimulating to specific cells in your visual cortex. And so with repeated exposure over time and at varying difficulties and contrasts, they can wake up a lot of these cells in your brain that help communicate vision from your eyes to you perceiving the world. And this helps improve your contrast sensitivity and ability to detect shapes and letters. So if you don't want to have to rely completely on glasses and contacts all the time, this is a way you can train your brain to kind of see in finer detail. And this translates to roughly about 2 lines of visual improvement in many of the published studies. That's basically going from here on the vision chart down to here. So if perhaps you're somebody who either has an eye disease like keratoconus, or you're just not happy with the quality of your vision, whether that be with glasses, contacts, or maybe after having an eye surgery like LASIK, this might be a program that could give you a visual edge. And this program has been around for like 6+ years. And I think finally now with more publications coming out, a lot more eye doctors are starting to recognize and come around to offering this. Again, this Revital Vision program is something that can be done from the comfort of your own home. However, it does require some hand-holding or supervision by an eye care professional. And so you do have to talk to your eye doctor about this. They do have like a doctor locator program, and I'll put a link to this information in the description if you'd like. Otherwise, certainly ask your eye doctors about it if they've heard about it and if it's something that they have offered patients. I have personally talked to a few different patients about the program and offered it. However, I don't have any patients that have gone through it just yet, and I'm kind of looking at maybe signing up and going through this experience myself for a future video. So if it's something you're interested in and you're not subscribed to the channel already, please do so, because then you won't miss out on our future content. Now, the second program I wanted to mention here is something called vision therapy, otherwise known as Orthoptics. If you've never heard of these programs, they've been around for a long time. In fact, it's an entire specialty or niche within the eye care field. Now, these are, I guess, in many ways, eye exercises. They have you do training using your eye muscles in different scenarios and different challenges to strengthen the eyes. But the kind of caveats I really need to point out here is that in most cases, you're not strengthening the eye muscles. You're improving the neural communication between the brain and the eyes to coordinate more efficiently. But doing these vision therapy or orthoptic eye exercises, they will not reverse your need for glasses, or at least they're not going to reduce your amount of nearsightedness. Your true refractive error will not change with these. Unless, and there's a big unless here, you happen to be somebody who has an accommodative spasm causing pseudomyopia, or you're somebody who's been over-minused in the past, which is a whole different topic. And in fact, we did a full video on that just a few months ago. And if you haven't seen that, I'll put a link to that in the show notes for you. And the reason I share this is because online you will find a lot of people who will claim that, hey, they went from a -3 nearsightedness to 0 or something like that. And the reality is that those eye exercises didn't legitimately change the true refractive error of the eye, because that's physics. It has to do with the length of the eye, and the shape of the eye doesn't have to do with the strength of the eye muscles. What likely happened is that they were either in accommodative spasm, where their muscle inside the eye was spasming, creating a false need for glasses, where they really just needed to learn to relax that muscle. And so that's where doing forms of eye exercises or vision therapy could help relax that muscle and learn that they don't need to use that high of power of glasses. But in my hot take opinion, if those people had properly been assessed in the eye clinic by a doctor who really knew what they were doing and making the correct diagnosis, then they wouldn't have gone home thinking that they reversed their need for glasses. They would have understood that, no, I just learned to finally relax their accommodative spasm. Or they would know that one of their doctors in the past had given them too high a power of glasses, and they were able to just, again, back off from that. Where vision therapy or orthoptic eye exercises truly come in to help are for people who have some form of binocular vision issue. The most common ones are accommodative insufficiency, people who have a hard time flexing the ciliary body muscle inside of the eye to focus on near objects, or people who have convergence insufficiency, who have a hard time getting their eye muscles to cross and, again, keep things single and clear at a near distance. But these vision therapy services are also utilized for people who've had head or brain injury, concussion, people who've had stroke, certainly kids who and adults who have one eye that drifts off to one side. Perhaps they're seeing double. These sort of programs can also perhaps help people with motion sickness and dizziness, all these different kind of symptoms. But where these vision therapy programs may fit in, even for people who don't have a specific eye or visual condition, is that these services could potentially improve fine motor movements in the eyes, such as tracking, being able to read a little bit easier without so much effort, being able to have less eye fatigue when on the computer. And this could translate to not only improved academic performance, but also performance at work and certainly in sporting activities. In fact, that is a whole kind of subspecialty within vision therapy, is sports vision training, where a lot of professional athletes and collegiate athletes go through various eye muscle exercises, these sports vision training programs, to improve how their eyes coordinate, follow and track balls and movements. To be able to recognize that a ball is spinning a certain way, to be able to predict that that ball is moving from one side of the court to the other, even when another player is eclipsing over their visual field, right? They can still reach out and catch a ball even though they're not directly looking at it. These types of vision therapy programs are often offered through local eye clinics that specialize in them. They usually are in person, but there are some doctors who do at-home-based vision therapy, sort of like coaching and training, which of course leaves it up to you to actually do that homework and do those exercises. But again, if somebody's trying to, biohack or improve their visual function in some way, these vision therapy programs might be a way to do it. But again, to find these types of services, you will have to probably call around in your local area or ask your eye doctor if they offer those services, all those different things. Which actually brings me to the third program here, which is kind of an at-home version of vision therapy in a way. This is a program called Amblyo Play, or here in the US is now referred to as iHero. This is basically an app-based program. They either use a tablet or a computer screen, and they send you kind of like 3D colored glasses. It's usually green and red glasses that you're looking through, kind of like old 1980s 3D glasses movies type of thing. But you play these digitized games on these app devices, and the difficulty of these games changes and adapts based on your own visual performance. But the glasses that you wear forces each eye to see things slightly differently, and not only trains them individually, but helps them work to get the eyes to work better as a team. And where I see this technology being kind of the most useful is because it is gamified, which makes it fun, and I think people are more likely to follow through and do something like that, which kind of goes to the analogy of like going to the gym, right? Just because you signed up for a gym membership, you're not going to lose weight or improve your fitness unless you go and put in the work. But I think this breaks down some of that barrier. Now, this Amblyo Play or iHero program is not like FDA cleared or approved for anything right now, but they did have a recent small study come out showing that it was effective at improving visual acuity and depth perception for kids that had amblyopia or lazy eye. And they did report some improvements in ocular motor movements, which I think is very promising, again, showing that you may be able to improve things like your tracking and fixation stability, and that can translate to some people having maybe improved reading ability, better visual comfort on a computer screen, less double vision, things like that. Again, depending on where you live, this type of program often does need to be prescribed or at least somewhat managed by an eye care professional, which I think is really wise because there are some eye care scenarios that you maybe don't want to be doing types of vision therapy on, because it is possible to maybe have an eye that's suppressed and then you wake up that eye and then all of a sudden now you're seeing double vision all of the time. And that might be a scenario where you don't want to do vision therapy. Okay, so from here, let me know in the comment section, A, if you have ever tried any of these programs. I would love to know kind of your results. Did you find success with it, yay or nay? And then B, if there's any programs, whether it be eye exercises or other forms of like vision therapy or something online, like an app-based thing that I don't know about, let me know in the comment section because I'd like to look into it. Otherwise, I hope you found this information helpful. Thank you so much for joining me. Keep an eye on it. We'll see you in the next video.